My hand doesn't look like a man, right?
No. And actually, your nails are look very nice.
Yeah, they're expensive.
Okay. So tell me a bit. If you're born as a boy, but you feel as a girl, and you want to have a transition, what you should do? What the process is?
Well, that actually really bad in my time. We don't have internet, right? So all we can do is just like we have to talk with friends, try to figure out how to do. And I just know that you can take the birth control pills because that's there's hormones in it. Then you can just keep taking hormones until you start to have boobs and look have better skin, look more female, and you should start early.
So you can get some hormones to begin to have boobs without to make implants, right?
Yeah. I have some boobs, a bit before I go through that process.
Since what age you began to get hormones?
I think when I was 13, and because I was talking with friends and we just like go to the pharmacy after that right away. And there are friends who just want to be just like me. We just like go to buy together. And after that, when I was 15 or 16, I just know that injection is better. I would not, within this time, I would not suggest anyone to do just like what I do. You should go to hospital and get your hormone checked and then let the doctor prescribe you for hormone therapy. That's gonna be the safest way.
Is it easy today to do all this? I mean,
Yeah. You can.
but
You can
back
go to
then it
hospital.
was more difficult, right?
Come again. Sorry.
Back then at your time it was more difficult to find the right hormones, to go to the hospital to get the right treatment, right?
It's not more difficult. It's hard to be able to access to the knowledge.
Oh,
That's
I
what I
see.
would
Yeah,
say.
as you said. So, as you told me, you just got some second-hand information from your friends, and then you went to the pharmacy. It was not any psychological evaluation.
On my time in the 90s, no. People just really start to talk about it and mention it, what you have to do after the year, I think 2005, 2006, that people start to talk about it, that a transgender is the issue that people start to notice and people really talking about it. You have to understand that my condition is like since the 90s that there's not that much knowledge out there about how you have to do with it.
So,
So I
so
have to deal with my own. So of course I made some mistake, but nowadays I really want you to seriously checking if this is what you want to do because it's gonna be really hard process. You want to reverse back to be a man again.
So nowadays the process is you are about 15, 16, you get a psychological evaluation first. I think in case you are not already dressed as a woman or be full-time woman, you have to be for a few months. And then if the doctors give the okay and you are 16, you can begin to get the feminization hormones, right? So this is the process now.
That's what you should do.
Yeah, this you should do, you think. And some girls they make some operation like feminization in face or anything they can do to their body. Some others they don't do that. And the final step is the surgery to change your sex is like the how it's called genital reconstruction, something like this, right?
Or you can say it easier like sex change operation.
Sex change operation.
Yes.
Always I forget these terms. So when the sex change operation happened to you? At what age?
I think when I was late 24 to 25, it's really expensive process It cost me that time 120,000 Thai baht.
Today probably is double this amount, right? I mean, 120,000 baht 15 years ago, it was like 250,000 baht today, right?
Yeah, that could be that, and I'm not really,
Almost,
like, back to that.
yeah, almost like $8,000 of today money, something like that.
And different doctors, different hospital, that could affect to the price too. So I'm just like gonna say by overall is around that price. Yeah.
Do you think in Thailand there are really good doctors with experience and knowledge, and it's a nice place to make this transition, this operation?
Yes, but I would not recommend it.
Yeah, of course, of course. Are they some also like butchers, very cheap ones that they don't do good job, or mostly safe to come here and to pick someone?
I would suggest you to really check the history of the doctor and the hospital and the review. Then you choose the best that fits you. You know. So you have to imagine a penis, right?
Yes.
So you're gonna have a testicle
Yes.
and penis. So what they have to do is they're gonna cut, the meat inside the penis, just
Yes.
leave the skin, right? And then they're gonna take the testicle part, the balls off, and then they're gonna flip that meat. Keep the top part of the penis because that's a sensational part. So they're gonna turn that into a clitoris, and then they're gonna flip it just like you flip a sock, put it back in, and then bring that part out to be the clitoris, and use the testicle skin and wrap it in to make it look like a vagina. So then voila, you have the vagina.
Nice. How long it takes?
For the process
Yes.
or the operation is around 8 hours if I recall.
8 hours?
Yes, 8 hours. 8 hours, and then I stay in hospital around 2 weeks.
Does it hurt when you wake up and you have your vagina? It feels hurtful?
No, I high as a kite. It's like you start to. It's funny because I never had big operation before, right? And then you're totally conscious, and then when I start to come back to senses again, I just like, am I dying? I reborn again, which is true. And then the nurse start to know that I'm coming back, and then she just like put me back to my room, and the first thing is what I'm trying just to touch me there, that okay, that part is gone, and it is. That's like the happiest day of my life.
I will ask you about how you felt, but tell me first, so how long it needs, let's say, to heal? You said you stayed 2 weeks in the hospital, but then it's a process you have to follow at home?
Yeah, actually, since the time in hospital, I think like the second day or the third day, the nurse gonna take out the cotton that they feel inside my, ovary
Yes.
system that they try to make, and then that's gonna be the hole. So with that, the doctor just gonna give something look like a tube, a
Yes.
long glass tube. And I just know that day too that I have to constantly put that tube inside of me every day.
For how long?
As long as you want, all the time. Imagine it like this: if you have an ear piercing, right?
Yes.
Then you have to constantly wear earrings, so the hole gonna remain there. So same thing, you have to constantly put that in to remain the hole. So it's a scar. Technically, it's a scar.
I see. And when you stop to put this tube in, I mean, it takes like, you have to make it, to put it for 3 weeks, for 3 months, for forever? I mean,
Well, normally you have to constantly put it, but I do have partners after that.
Okay.
So I don't really require that. But that's just my personal thing. I would not recommend anyone to do so.
okay. So now tell me about the psychological part. How did you feel when you saw yourself in the mirror and you touch and you know that this thing gone? You said it was your happiest day in your life, right?
I actually takes weeks after I actually can see it because I have to go home. I cannot walk. I hardly can walk. It's pain. It's down there. I just laying in bed for I don't know nearly a month, you can say, and then my mother is the one who helped me clean it because we have to put betadine to clean it inside every day to get the dead skin and dead blood out. So it kind of hurtful process on that day. And
But you felt very happy.
today, with that, yes.
Okay. Why some transgender people they choose to not perform this operation to keep their male genitals? I mean, you obviously you will have friends, people you talk with them. Why they make this choice?
Well, I think just like we ever talk about, the binary and the gray area that I was talking, some people think that they are women, but they think that it doesn't require a vagina to be a woman. You understand?
Sure.
So that's why they already feel woman and they're happy with a woman that has a penis. So they just want to live their life that way, and I respect that.
I see. There are many people believe that if you have this kind of operation, so you cut off your penis, you cannot have orgasms anymore. Is it true?
No.
It's not true, right?
Okay, actually I have a clitoris as I mentioned before. I also can get wet. I definitely can get orgasm.
But probably it's a little bit harder. You have to learn how to go to this point.
Well, I think if the man knows the right place to touch, then he can make it. It's
Oh,
not a rocket science.
okay.